Welcome back to our channel today. We'll be talking about an increasingly important topic in healthcare: chronic disease management in the elderly, specifically those aged 65 and older. As we age, our risk of developing chronic illnesses increases dramatically. Conditions like diabetes, arthritis, heart disease, Alzheimer's, and cardiovascular disease are not only common, they often occur together, a condition known as multimorbidity. In fact, as of 2025, around 20% of individuals aged 55 and older are affected by multiple chronic conditions, with rates even higher among those 65 and older. But these numbers aren't just statistics. They represent real people: our parents, grandparents, neighbors, and eventually ourselves. Let's explore the impact of these diseases and what we can do to improve quality of life in our aging population. Common chronic conditions. Let's begin by understanding the most common chronic diseases that affect the elderly. Diabetes affects about 25% of adults aged 65 and older. It increases the risk of kidney failure, blindness, and limb amputations. Managing blood sugar through diet, activity, and medication is essential. Arthritis is the leading cause of disability among older adults. It affects mobility and independence, often leading to social isolation and depression. Both osteoarthritis and rheumatoid arthritis are prevalent. Heart disease remains the #1 cause of death among people aged 65 and older. High blood pressure, cholesterol, and lifestyle choices all contribute. Alzheimer's disease and dementia. Over 6.9 million Americans aged 65 plus are living with Alzheimer's in 2025. This number is expected to grow as the population ages. The disease slowly robs individuals of memory and function, placing a heavy burden on caregivers. Hypertension. Nearly 2/3 of older adults have high blood pressure. Often called the silent killer, it contributes to strokes, kidney disease, and heart attacks. Multimorbidity refers to having 2 or more chronic conditions simultaneously. It affects over 60% of adults aged 65 plus, complicating care and increasing hospitalizations. Depression and mental health. While chronic physical illnesses in older adults are widely recognized and treated, mental health often remains overlooked. This gap in awareness can lead to underdiagnosis and insufficient support for mental health conditions among older populations who may already be navigating complex physical health challenges. Depression, for instance, is a serious yet often misunderstood condition in aging adults. It's important to understand that depression is not a normal part of aging, though it is common. In 2025, an estimated 7 million older adults in the United States are experiencing symptoms of depression. These symptoms can significantly affect daily life, relationships, and overall well-being, especially when left unaddressed. Depression frequently coexists with chronic physical illnesses such as heart disease, diabetes, or arthritis. This overlap can make managing either condition more difficult, as mental health symptoms may interfere with treatment adherence, motivation, and recovery. Addressing both physical and mental health together is essential for improving the quality of life in older adults. Unfortunately, only 10% of older adults with depression receive proper treatment due to stigma, lack of screening, or underreporting of symptoms. Older adults facing illness, isolation, or the loss of loved ones are at higher risk. It's important to screen regularly and treat depression with therapy, social engagement, and sometimes medication. Challenges in managing chronic diseases. Why is chronic disease management so challenging in older adults? Polypharmacy. Older adults frequently manage multiple chronic conditions, which often requires taking several medications simultaneously, a situation known as polypharmacy. While each prescription may be necessary, the combination of drugs can increase the likelihood of adverse drug interactions and side effects. These risks are compounded when patients see multiple healthcare providers who may not be fully aware of the entire medication regimen. As the number of medications increases, so does the complexity of managing them correctly, leading to potential issues with adherence, confusion about dosages, or unintended duplications. Cognitive decline. As individuals age, cognitive decline, including memory loss and reduced executive functioning, can significantly interfere with the ability to manage health effectively. older adults may forget to take their medications as prescribed or miss important medical appointments, which can lead to worsened health outcomes. Even when caregivers or reminders are in place, cognitive impairment can affect decision-making and understanding of medical instructions, making it challenging to follow through with treatment plans consistently. Social isolation. Many older adults live alone or at a distance from their family and social networks, which can lead to profound social isolation. This isolation not only contributes to mental health challenges like depression and anxiety, but also affects physical well-being by limiting access to timely health care and informal caregiving support. Without someone regularly checking in, signs of illness or deteriorating health may go unnoticed, and the individual may struggle to seek help or manage daily health tasks. Access to care barriers such as limited transportation options, high healthcare costs, and physical mobility issues can make it difficult for older adults to access regular medical care. These challenges may cause delays in diagnosis or treatment and discourage routine checkups, leading to preventable health complications. For those in rural or underserved areas, the problem is often worsened by a shortage of nearby healthcare providers or facilities, further reducing the ability to receive consistent, high-quality care. Fragmented healthcare systems. Older adults often receive care from multiple specialists, such as cardiologists, endocrinologists, and neurologists, depending on their health conditions. Unfortunately, the healthcare system is frequently fragmented, meaning these providers may not communicate or coordinate care effectively. As a result, patients may undergo unnecessary or duplicated tests, receive conflicting medical advice, or experience gaps in care. This lack of integration can be confusing and overwhelming, especially for older adults managing complex medical needs on their own. Patient-centered care. Care should be tailored to the individual, understanding their priorities, whether it's reducing pain, increasing mobility, or staying independent, makes treatment more effective. In summary, chronic disease management in adults over 65 is one of the most critical healthcare challenges of our time. With nearly 1 in 5 adults over 55 managing chronic illness and even more dealing with multiple conditions, we need a proactive, coordinated, and compassionate approach. By blending medical care, technology, mental health awareness, and community support, we can help our aging population live longer, healthier, and more fulfilling lives. Let's not treat aging as a problem, but as an opportunity to enhance care, dignity, and quality of life. Thanks for tuning in. If you enjoyed this, don't forget to like, comment, and share your thoughts below. Stay tuned, and we'll see you next time.